Hello, this is Corey Durbin, CEO of SHARx, and this is the Rising Tides podcast. Each week, I have the privilege of speaking with influential athletes about their rise to fame, the dedication to their sport, and what it takes to be successful. Let's dive in. It's great to see you today. It is awesome to be with both of you. I have the good fortune of being with Dr. John Oertle today, who is the Chief Medical Director at Envita Medical Centers in Scottsdale, Arizona. They are a very key partner for us in the Sonar Health model, SHARx Plus, that we've rolled out. Also have the privilege of being with my business partner and our Chief Growth Officer, Paul Pruitt. Dr. Oertle, how are you today?
Oh, I'm doing great, Corey. Thanks for having me here.
Appreciate the time. You guys have a lot going on. Paul, how are you today, buddy?
I'm wonderful. It's a beautiful day.
Good. Well, we've got a lot of stuff that we can talk about. I think one of the things that Paul and I are most excited about is how is engaging beyond supply chain management and procurement, which we intend to and will continue to make an emphasis of SHARx, and having a vehicle to help our members truly find a road that's different and have opportunity to get and stay healthy. So we love what the story is about Envita, and I don't know that anybody could give us an overview better than you can, Doc. So do you want to give us a little bit of overview of how you guys got started on this journey?
Yeah, so Envita Medical Center began 25 years ago, and it began with Dr. Dino Prado, who began it to be able to really say, even 25 years ago, there was this gap in healthcare outcomes, and saw that people that were dying of terminal disease and jumping around from doctor to doctor, not getting a good diagnosis, and just really set out to be able to change that mission, to be able to say, what can we do to be technology driven and data forward, to be able to really treat these most severe diseases within our society. And with that, Envita began, and it's continued to be able to grow. We talk about, we really have focused on more a precision model of healthcare, where if you're able to actually look at, not just going into, say, for instance, a diagnosis of like fibromyalgia, or with, pain in all four quadrants, but what's the cause? What's the reason for it? Really deep diving into the data and the metrics to be able to see, how do we actually work with the body in order to be able to diagnose what's going on? Is it a toxin? Is it a various infection that the body's been going through? Is it a nutrient deficiency? And really being able to actually use a technology forward biomarkers to be able to evaluate, to be able to then serve our patients and reduce their medications, or even bring them off completely, and bring true healing to the patient, actually getting well, to be able to have a health care model instead of a sick care model. And so this has been what we've been doing for the last 25 years. It was really illuminating to us, though, about 5 years ago. We've been doing this in Scottsdale. We've continued to be able to grow. We're about now 8 campuses, over about a quarter of a million square feet in space here in Scottsdale. But what we realized is that there's a real need for, you see these outcomes that we get, our terminal cancer. We just published a paper on our terminal cancer. We were 35 times better outcomes than the standard of care National Cancer Care Network guidelines, that are using kind of this very algorithmic, flow chart of one size fits all kind of model of healthcare. When we actually take that precision approach and are able to actually look at those outcomes, we were 35% better. But what was also really exciting to us with our third party actuaries is that we actually found that we were half the cost. I mean, half the cost. And we were so excited about that, because we have a very white glove approach. We do a lot of testing on the front end, and then designing these protocols. But being half the cost really opened our eyes to be able to say, this needs to have more access and availability, because we were, for those 20 years, we were all just a cash pay model, completely cash pay model in this. And we said, again, there's got to be, other areas of the industry that can start to utilize these services. And that's really where, we see the, rates of cancer on the rise. The greater than, this is one of the concerns that we have, is that we see, the younger than 50 and younger, we have an increase in cancer rates, ever since about 15 years ago, it's been on the rise, at least 2.4% year over year. And these are in the younger cancer cases, especially the GI cancers, the colorectal cancers, and screening even for colorectal is doesn't happen until you don't get that colonoscopy until you're 45 years old. And for us, it was this, again, these younger cancer cases that we still continue to see rise. And this is where being able to see this and being able to actually treat these cases with a precision approach and have those better outcomes was really important to us, but also not just then look at, the better outcomes when you do have cancer or when you do have a chronic disease like an autoimmune or neurodegenerative, and the costs just continue to escalate, but for employer plans. But then there's also the dynamic of being able to make sure that we can utilize these treatments and the technology and the data that we've accumulated over 25 years in having these outcomes to then start to be able to actually put forth plans to prevent disease. Because it's more than just going to see your primary care. Now our preventative programs are more than just this going to see your primary care and, running a basic blood work and be told that you're overweight, and then be told that you have high cholesterol and high blood pressure. And, you come away from your primary care doc and you're thinking, well, thanks, doc, but I'm going to see you next year. And now I'm left to be able to, be on this high blood pressure medication and this hyper cholesterol medication. And yet I'm not sleeping well. I'm fatigued. I can't think. My short-term memory is diminishing. And what is actually going on? And there's biomarkers, there's data that is able to be ran to be able to actually look at how do you actually put these programs together to be able to be optimizing your health and to be able to prevent these cancers and these actual diseases from occurring. And so that's really where this advent of what we've started to work on over the last 5 years to be able to really conquer this access to precision model of medicine with our center of excellences, but also being able to actually prevent disease before it actually happens, so we can actually make America truly healthy and keep them healthy, and making sure that we're able to actually move in a direction that is intelligent and not just throwing more money at a system, that we can actually reduce cost and improve outcomes at the same time.
Yeah, I want to spend a minute on that prevention and mitigation idea. And I want to ask Paul, like, as many presentations as you do with prospective clients and even existing clients on SHARx Plus, and the 2 meetings we've done where we've launched this, Paul, it seems like the level of engagement and interest in this piece is really, really high. And I wonder if it has a lot to do with with the multitude of autoimmune conditions that are on the groups. But can you talk about that and what the reaction has been, and the follow-up questions that have occurred, and anything you want to, wherever you want to take it with Dr. Oertle from there, go for it.
Absolutely. I think talking about the role that Envita plays with Sonar Health is one of my favorite parts, and I have to make sure I don't spend the whole time on that piece. And I think it's such a personal story as we talk about the impact that Envita has been making with their members and why it's so different, and excited to hear Dr. John's take on how they're able to do that. But that's normally the piece that everyone says, well, every client I have has these same problems. They have cancer cares that become large problems. We know that it's difficult for members to go through those treatments. And when I talk about the autoimmune results, that is another part that I think gets a lot of people excited, because they know their clients have all had some devastation with autoimmune medications, and knowing, wow, we now can do a lot more in that space. So Dr. John, I think you touched on a word, and I'd love to hear, kind of dig deeper, but you said precision medicine. So I think I would love to maybe start with what exactly does that mean?
Yeah, so precision medicine essentially means that we are going to look at your individual biomarkers, genomics, transcriptomics, other factors like how the actual metabolism is working, how the actual immune system is working, And it all kind of depends, or even root causative factors, like for instance, looking at, carcinogens in cancer or endocrine disruptors, plastics, and there's these microplastics that are playing a role in how our endocrine system is actually working, or phthalates, or things that are in our cleaning products, or things that are in our hair products, air pollutants, all of these things that could potentially be playing a role in how our bodies are able to actually clear. And it's complex. So there's ways in which you can test. There's exposures, but also looking at how our body integrates with this. This is so interesting. There's people that are able to metabolize these toxins really rapidly. And so these are people that don't, even though they're exposed in our society, they don't develop disease from it. But if you're a slow metabolizer of this, and your body's nutrient deplete, that doesn't have the nutrients that are driving these pathways, it's like a clogged freeway. You're not getting through. And so as far as this goes, you're clogging and causing a lot of stagnation. And if that stagnation is happening in the breast of herbicides and pesticides, or if there's chronic infection that's present, then guess what? It's starting to create this pathway of disease that, again, eventually continues to grow into cancers. And so this is where, when you actually are looking at the patient, you do this for cancers or these really complex chronic diseases. It's more than just being bounced around from physician to physician to be able to say, okay, let's start to actually do a deep dive on running the right tests. I hear from a lot of patients too, they're saying, well, doc, I went to the doctor, I have had all these tests being ran. And it's really interesting is that you look at, you think your doctor, or you hope that your physician is running the right tests, or they have run tests, and you've run a lot of them. You've got a lot of blood work pulled, and they're like, they can't find anything. And I'm saying, well, if you're not running the right test, then you're not finding the right cause or the right reason why this disease process has gone on. And so really, this is where what's special about it is that over these last, we didn't begin this way 25 years ago, but because we are absolutely unforgiving in the ability to be able to treat and heal disease and focus on outcomes, we've continued to just push and push and push and develop our algorithms based upon data so that we are running the right tests in the right situation, and we can start to be able to actually illuminate exactly why these diseases have begun. I'll give this example, right? I'll make it personal for myself. Again, I like to share this. I don't think I've ever shared this with you guys. How did I get involved in this? Well, I was a type 1 diabetic when I was 10 years old. And type 1 diabetes is an autoimmune condition where my body creates an autoimmune response to my cell and my beta cells in my pancreas. This was a direct result. What's really interesting, this was a direct result. I had a vaccine reaction to the vaccine DTP. Yeah, this is the pertussis vaccine. Again, they've made it a little safer. They've now made it DTaP, or it's safer now, but it still causes a type 1 diabetic response. And so, but for me, it's one of these areas too, where when you actually start to find in that triggering event, you focus on this. And actually, my story was that, this is one of these areas of prevention that, when I was a kid, 10 years old, my mom was really my hero. She's focused on prevention. And I'm already a kid that loves biology. I love how my body works, and I love that I'm eating something, and this is what it's actually causing, learning my own metabolism. But what ended up happening is that when I was 18 and going into college, I ended up having, I go to see my adult endocrinologist. And when I was in with the adult endocrinologist, I'm literally sitting in the waiting room. I remember it like it was yesterday, sitting in the waiting room, and I'm seeing all these patients that are blind or that have been amputated. And I'm thinking to myself, goodness, wow, I don't want to be like these guys, And I was already wanted to go to medicine. I was pre-med, and I wanted to be able to go to medicine. And but I met with the doc then. I remember this. And the doc literally says, John, you're doing great. Your blood work looks great. Everything looks great. Keep it up. Keep up the good work. And I go, Doc, is there more that I could do? Is there anything more? Can I be healthier? What do you recommend to be better? Anything that I'm not doing that I can do to be able to make sure I can stay well and be preventing all of these complications? So he gets down and he writes out his script pad, and he writes lisinopril. And this is a medication for blood pressure. And as a young 18-year-old, I'm like, well, Doc, what is this? What is this for? He goes, oh, this is a blood pressure medication. And I go, but doc, did I have high blood pressure? He goes, no, but this is a medication that may prevent your kidney damage in the future. So you need to be able to begin to take it. And I'm literally wrestling with myself. Does this make sense? I'm already starting to do research. I'm asking all the people in my life. And I knew Dr. Prado, who had started Envita, but as chance would have it, I actually met up with him again at a mutual friend's birthday party here in Tempe, Arizona, the week after that. And I meet up with him and we start talking. I'm asking him about this and we deep dive into all the possibilities of what could be done to prevent disease and to be able to go through this precision biomarker process. And I actually became a patient of Envita myself and learned how to be able to actually take this precision model and then become, again, the ability to drive this so that I actually am staying healthy. And it's more than just a lisinopril prescription. And I'm so grateful I did because it's changed my whole trajectory of my life. And I have firsthand knowledge of this. My grandmother had rheumatoid arthritis. And she passed away last year, but she had rheumatoid arthritis. We were able to take my grandmother with rheumatoid arthritis and run the right tests and put her on the right program that she was able to completely come off of her rheumatoid arthritis medications because we were able to find infection and treat the actual underlying root cause very simply with it, but she was able to completely come off those medications, things like rituximab, very expensive medication, very expensive. Now she didn't need it anymore, she didn't need it anymore. And she lived out her whole life, ever since we actually treated her in complete disease remission as far as this goes. And so this is the hope and what we see, all the time. And so it's really, it's beautiful to see that even with now our models to be able to provide this in, all 50 states through a telehealth model that's able to actually have remote testing and being able to actually make sure that this is taking place. It's powerful because this is really where you can start to impact change and start having access to what only, for so many people, for only a select few even know about or have access to now is available through your guys' program, Sonar Health, and for employees that are actually taking part in this.
Doc, in a previous life, Paul and I had a wellness organization, and one of the concepts behind it was that everybody has unique bio individuality. So treating everybody exactly the same is not the answer. And I'm kind of fascinated by the idea of what you were going through, and the gap sometimes in my mind is we're not asking the right questions. And it feels like you asked yourself a better question at the time and said, how do we get away from just treating the symptoms to addressing the root causes? And it feels like you got to that place, and part of Envita is the idea of let's ask better questions for each patient specifically.
Yeah, it is asking better questions. And then the other thing that I think is really an interesting dynamic is that we see that technology, just, I don't know if this model is available 50 years ago, because you see that with technology, as it continues to drive and that ability of knowing, I mean, it's deep learning models of being able to take data and make sure that a precision individualized approach is being given for every patient. Just thinking about it from a public health standpoint, very difficult to do precision medicine when you don't have a technology platform that's helping to drive these changes where an individualized approach is needed for every single person. But as we've seen technology continue to advance and these deep learning models continue to allow for precision to be able to be allowed for more population, it becomes very powerful. Because again, there is a matter of, we were just talking before the show, there's a matter of time in a day and there's a time of your resources. But this is where when you put together programs that are able to be reproducible, that are individualized for a large perspective that's scalable, this becomes very promising and so beautiful to be able to do this, that technology really becomes our friend in that ability to be able to give that individualized response. I just don't know if we're utilizing technology in the way that it's possible across medicine today. So,
And speaking of this idea of precision medicine and kind of scaling it, I think that kind of dovetails nicely, and I'd love for you to talk more about the biolytics program that you guys have.
yeah, so this biolytics program, this is when I was mentioning, this is what is our national program that allows us to be able to take somebody, an employee or an individual, to where they are able to, go into actually talk with a doctor in a telehealth model. But before they talk to the doctor, we bring them through a program where they're able to actually have full ability to get all of their forms all electronically filled out, all of their information, and it's a very detailed form, even looking at family histories and all the medications that they're on, and plugging them into an actual program. And then we run remote testing. Even before they get to the doc and see the doctor, they run our baseline remote testing. So that already then it's all crunching it into our system that we've built, all deep learning, to be able to then program and come out with, this is your individualized treatment plan. It's been reviewed by the actual doctor, but we're looking at even things like not just your chronological age. Your chronological age is how long have you lived on this earth since the time that you were born? And we look at biological age. So this is where it's how old are you really? And we've had people that have been 50 years old and having a biological age of 66. They're 16 years older than their biological age was, and they see that it's not just a theoretical number. We actually know exactly why and what's driving up that biological age. And so then we start to put forth plans to start to drive those numbers down. And this is all based upon your own data. This is what's so exciting. This is not just a theoretical, hey, you should go on this diet because this is what, the YouTuber, the influencer said, and this is, I'm curious about this. No, you're actually having this be based upon you and your information, and then the latest research that's out there and our algorithms, and then you're meeting with a doctor to discuss it, and the doctor reviews it and is able to go through the whole plan with you. And this could be a switch of medications, because there's a dynamic here too, that some medications are just not processing out through the system. This is kind of this dynamic of what's called pharmacogenomics, in how do medications process out. We're so different as human persons. So when you look at how quickly a medication is metabolizing, this is similar to, give you this example, redheads have this gene, okay, where you get anesthesia and we rapidly move anesthesia out of our bodies. Okay, we have a higher pain tolerance as well, all right? This is why Conor McGregor and the Scots are able to fight in spirit. But again, there's a bit higher pain tolerance, but we metabolize your anesthesia medications out of the system. So if you're a redhead and you have this gene, you're going to go through, maybe a surgery. You're going to wake up in the middle of surgery. How nice would that be to be able to, how nice would it be to be able to know those medications, then how quickly you metabolize it beforehand. So you're already preparing for that. Or even in the case that you are slowly metabolizing it, and then you're almost, it's going toxic. You're reducing your respiratory rates, and it's very dangerous going through surgery. How nice is it to know that, so you can do less medication that's going to pair with how quick the body's going to metabolize. But I give this example because this is a part of that biolytics process. If there's concerns for this, and you're on medications that are concerning, we have programs where that's actually a part of the thinking, that again, you'll be able to have access to that. There's one of these, it's a high blood pressure medication. Cardiologists oftentimes prescribe, it's very common. But this is where it doesn't metabolize very well of the body. And it actually increases. If you have these genes, it actually increases the risk of actually dying from kidney failure about 7 to 8 years earlier. So it takes off 7 to 8 years of your life when you have this gene and you're placed upon this medication. What's so interesting, cardiologists are placing people on this high blood pressure medication to try to prevent renal damage and kidney disease. And yet when we don't know, you're actually causing it. So this is where, when you start to be able to illuminate on that, this is where there's whole algorithms in place to be able to say, we need to evaluate this. This is the next step of testing. This is what we need to be able to do. So we take it in a piecewise approach with that biolytics program as well, but it becomes very powerful to be able to make sure that it's more than just this wellness program. It's more than just this ability to say, well, it's a one size fits all, everybody gets this. It really is. It's this access to saying, with the current data that's currently out there, with all the peer reviewed data, with all of Envita's 25 years of data, and then individually, what are your conditions, family history, all of your blood work, and plugging this into, this is now your biological age, and this is what we need to do to be able to start treating. What's so interesting as well is that I've had biohackers go through this program. People that are super like, I don't know if you guys know the term biohackers, but it's people that are online, influencers that are super involved in their own diet and lifestyle, and they try to do everything to be able to advance their age. I mean, there's people now that are trying to be able to live, beyond 120, 150. I believe that you can live to 120, and this is our goal as well. I think that we shouldn't have a reason why we're dying before 100, from chronic diseases. And we see this all the time. Even our national life expectancy is reducing now. So our kids are going to be the first generation that doesn't outlive our parents. And so that is hugely concerning. So again, even with, I feel like I'm now, if you ever see The Matrix, I feel like I've been red pilled, right? I think it's the red pill. But I feel like I can't not see this, because it's like, when you start to see this, it's like there's so much that can be done that's not being done. And this is critical to advance. And it's a mission to be able to say, you know what, you're meant to live longer. And it's not just the CEOs or people in Hollywood or the people that have access to this information, but this is available through this system, from the CEO to the janitor, from the biolytics. And that becomes super powerful to say, now we can actually start making an impact on aging, and actually being able to not just, it's not even just age, because this is the other dynamic. People are like, well, doc, do I want to live to 120? I get this question. And I think, well, if you are living a high quality of life, where your bones aren't deteriorating, your joints aren't inflamed, your mind is actually working effectively, and you have a high quality of life, which is what the biolytics program is designed to do, is say, how can we optimize this health? You start to be able to say, I can actually live to 120 with a high quality of life and not pass away from, we're going to prevent dementia, Alzheimer's, Parkinson's, these different neurodegenerative conditions, because you're starting to see, let's start to prevent this. There's a lot of data behind that. And so I was saying about the biohackers, though, I've had biohackers that their biological age is definitely better than their chronological age, definitely, but they still have opportunities to refine, and that they didn't know with all the work they're doing, when it's still run the blood work, giving this ability, there still is opportunities for them, that there's knowledge to start to refine even the most advanced biohackers that are out there that they had no idea about, because now you're actually building it off of, their own data and all the research, the peer review data that's out there. So it's pretty exciting as far as that goes.
Wouldn't it be grand if we shifted from the concept of just treating the symptoms to, like, let's eradicate this? And I wanted to ask you, what's the connection between gut health, microbiome issues, and autoimmune and cancers and the things that are going on? Because I think there's a lot of people that will be listening to this that might have some revelation on this, if you'd share on that.
Yeah, the gut is always impacted with chronic disease, almost always. And it's because one.
And is it vice versa too? Like if there are gut issues, then it's also could potentially be causing some of the other. Sorry to interrupt you, but is it true? Is the inverse true also, or is it just one way?
It is a relationship between dynamics, but when you start to look at the gut health and you start to have microbes, we've done a pretty good job. What's interesting is that we've done a pretty good job in medicine to be able to learn about the human, how human cells communicate to one another. What's kind of the new adventure in discovery in medicine is, how do microbes communicate, and their communication and their cell signaling, with how does that interact with human physiology? And so this is really, it's a new discoveries. There's always new correlations being put forth, seeing how do infections or how do our microbes influence our own health. One, there's a couple of things that really are helpful for this. 80% of your immune system is around your GI tract. 80%. So many times when there is an autoimmune condition, we'll talk about this, and the immune system is not functioning appropriately, where do you look? Well, you look at the GI tract, because again, 80% of your immune system is surrounding that GI tract. If you have a poorly, your microbes that are in are dysbiotic or not in good ratios, or if there are pathologic bacteria, parasites, or other fungal in the actual GI tract, and you're seeing this again, almost you can think about it that I almost conceptualize it that the body almost feels under attack, and it's mounting this ready to respond, because that's what the immune system does. It protects your body from foreign invaders. And so, and it keeps the body regulated. Well, if the body's feeling like it's going to attack because it's got this dysbiotic bacteria in the GI tract and it's not functioning well, it's under this like heightened response attack. And then it takes, again, some things like it can just trigger. Maybe it can be, it's another triggering event. Oftentimes there's dynamics of even the mental emotional, or you go through a traumatic event, a car accident, or a grief or a death in the family, a divorce, starting to be able to take this already kind of powder keg response and starts to trigger it. Or a vaccine on this end, right, that I had, again, it starts to trigger. It wasn't, and this is where too, there's healthy ways that the body can respond to a vaccine. And then there's unhealthy ways. And it's this powder keg that my body then, okay, it was an event that triggered. And if my body was working well, my grandfather had passed away, right before as well. All of this mental, emotional, my immune system isn't working well. All of this starts to develop this narrative as far as why do these autoimmune conditions exist? So it's not, it's you have to be, again, it's not just this isolated in a vacuum. It's a complex dynamic of a lot of systems that start to be able to then trigger and start to play the role. And so when you start to then look at and identify the actual, what are those deficits in the body's health, and start to be able to impact that, again, that's where you start to be able to receive that response. But that gut, even just the gut, a lot of people are now familiar too of mental emotional disorders, anxiety, depression. Again, how does the actual gut affect our brain, signaling of microbes? We see this with obesity, the gut microbes that are influencing obesity, the gut microbes that are influencing dementia, Alzheimer's. So this is where it is a critical thing. The other interesting fact I always find too is that we are more, our gut microbes, we have more gut microbes in our body, in our GI tract, than we do our own human cells in our body. So to be able to think about this, you are more not you than you actually are you, as a result of, that our gut microbes are, that there's more of those microbes living in Corey. You're the gut microbes of Corey than you are your actual human cells. So it is complex, but it's one of those areas that I'm very excited about when it comes to the discoveries of advancements of precision medicine in the future. But what we do know is that you put these regimens together, you start to heal the gut, you start to be able to work on what we do know, and it starts to be able to drive improvement.
So, Dr. John, earlier you kind of teased us with the results that you're getting with the oncology program at 35 times better than kind of the national standard. I'd love to learn more about why. What are you doing differently that's creating such different outcomes for patients?
It's a great example. So right now, when I talk about the National Comprehensive Cancer Network guidelines, or what's currently being delivered, and this is in all cancer treatment facilities across the country, I like to always say doctors get paid for, or doctors do what they get paid for. This is hospitals do what they're getting paid for. They're not, and so when you start to see this, you start to look at what is actually the traditional insurance companies covering. And they cover this National Comprehensive Cancer Network guidelines. So I always like to say, tell patients that when you're looking at surgeons, it's really important. Surgeries and surgeons have good quality. Depending upon where you go, you want the best surgeon. You actually want to base it upon data, not just how their Google review is or how nice their staff is. You want to be able to really look at what are their attributes, especially with, say, for instance, your recovery rates or your rehospitalizations or your infection rates or your mortality rates. And this is another data-driven metric, and this is where it's helpful to drive to surgeons that are able to actually have better outcomes as well. And that depends on the facility, depends on the surgery. But when it comes to medical oncology, when you're able to actually do chemotherapies, okay, this is where if you're given stage 4 colorectal cancer diagnosis, which means that the cancer is spread from the colon to the liver or to the lymph nodes and elsewhere in a separate organ of the body, what you get is that you get a one-size-fits-all approach, and it's a cocktail of chemotherapies that are going to treat that disease. And it doesn't matter where you go or what facility you're treated in, because this is what your insurance company is going to cover, is that combination of chemotherapy, okay? So what we do, instead of actually just moving forward and going through that process, and if you have that, you need to be able to go on this regimen. We actually say, hold on, let's actually do some data first. Let's run all of these biometrics. And a lot of it is saying, again, we're running blood work, liquid biopsies, actually taking cancer cells out of the blood that are floating around. We can analyze that. We look at the cancer cell-free DNA. This is oftentimes it's a DNA that's floating around in the bloodstream coming from the cancer that's mutated. So we know exactly what mutations these are. Many times people think about this. You can think about this technology has been widely accepted now, not in oncology, but in obstetrics. So with pregnancy, this is where moms can go in and get a blood test from mom and yet know exactly the full genome of the baby. You know the sex of the baby, any genetic diseases of the baby, and this is widely accepted now. There's actually states that have made it mandatory for insurance companies to cover this test in pregnancy for moms. Where we use that data though, and we say again, you were able to see the shift or the mutated DNA of a cancer cell from a blood test. And when this is going on, and we run, a lot of other biomarkers looking at the metabolism, the immune system, we actually look at not just how the gene is mutated, but then the actual signaling. It's called proteomics or transcriptomics of what the actual gene or how much the gene is actually working to either grow the cancer, invade the cancer into the tissue, or even there's molecules that make it more likely for a cancer cell to attach onto a tissue to start a metastatic disease. So this can all be elaborated in the testing. And so what we say is that, again, when you test and you actually are seeing this and seeing what drugs are showing to be effective, what chemo agents are showing to be effective, what we see is that there's already in 90% of our patients that cancer patients are being prescribed one or multiple drugs that are already showing resistant, meaning that the drug is being prescribed, but with the data we're showing that the cancer is already resistant to it, meaning it's not doing anything to kill the cancer, but it's still chemo. So it's still going to be toxic to the body. It's still going to cause the same toxic effects that chemo causes, getting to the brain, causing chemo brain, immune system suppression, GI, it kills the GI tract. Just think about that as far as
So it's killing
you want to
something.
save the GI tract. If the immune system is surrounding the GI tract, you want to save the GI tract. So that's the first thing, is that you want to select the right drug cocktail. Second thing we do though is that we also look at not just chemotherapies, but we also look at there's other things that are like off-label use medications. I give this example, do pharmacy. So again, there's drugs like doxycycline or Celebrex, or again, it's a rheumatological medication. There's a molecule on cancer cells that's called MMP or metalloproteinases. What this does is that if that's present on a cancer cell, it starts to allow that cell to invade into the tissue. And so it can cause the cancer cell to grow into tissue, or it can, if those cancer cells spread, it allows that cancer cell to be more sticky, that starts to adhere to other tissue and start to metastasize and spread. Chemotherapy doesn't treat that, but guess what does? Doxycycline does. this Celebrex does. So you can find other ways that the cancer cell is moving and getting into tissue, and you start to put it together with the protocol that Envita is designed, that you can do these drugs safely with the chemotherapy. And then we also look at other things. I mean, we have other things like natural agents as well, curcumin, that is very powerful. But again, many times people hear about turmeric or curcumin. They've heard that it's very anti-inflammatory. Maybe they've heard that it's been great for dementia, Alzheimer's, good for rheumatological conditions, but they've heard that it's good for cancer. And I would like to say, well, maybe it's good for cancer. Again, we actually want to make sure that you have the targets and the biomarkers that curcumin is using to actually help support and augment the treatment response. You know, there's genes. This is so interesting too. There's chemotherapy that becomes resistant, like cisplatin, and knowing the actual molecules and the resistance of the actual genes of the cancer, you can take curcumin and actually turn that gene to be sensitive to cisplatin again. Basically, the combination makes the chemotherapy effective, where it was no longer effective. And so this is where this ability to be able, it's just so neat, and it's so beautiful to actually have this ability to run the tests and say, okay, this is the actual, it's not just me guessing anymore. It's not just me taking cancer and saying, well, here's the cocktail because this is what your insurance company is covering, and this is what you're going to do. And let's go to Vegas and roll the dice. And a percentage of those times it's going to respond, a percentage of it won't. Instead of actually just rolling the dice, you're able to say, we can actually be more sophisticated in this and seeing if this is a treatment protocol for you. So that's just one of the ways. The other thing that I always like to say too is that when you look at the data, this is so fascinating to me, is that the pharmacokinetics of this, when you take an actual IV of chemotherapy, and this is always where too, it's not even oral chemotherapy. Oral chemotherapy, you may have absorption issues of actually absorbing the chemotherapy so it doesn't get into the bloodstream. But I'm talking about 100% absorption getting into an IV. How much of it actually gets into the actual tumor? Well, the data actually suggests that about 5 to 7% of chemotherapy gets to the tumor. So we've developed ways. One of the therapies we have is called CIPI, chemoimmunoprecision injections, where we can actually take those genetic targeted medications that are already showing sensitive to the cancer and the combination, and we take catheters the size of your hair and direct them under guided imaging directly to the tumor. And when you actually direct them to the tumor, we're getting 95 to 100% absorption of those medications. So what does that do? We can use less medication, less toxic effects, better responses. You see, so this is where it's just so beautiful to be able to utilize. I feel like, you know, one is the insurance medical complex. I'll speak, you know, you have doctors wanting to be able to do better. And this is where it's a system-wide issue, that these systems that we've built don't allow for many times innovation and ability to be able to actually move forward. Big insurance is one of these issues with this, is that it creates a very stagnated growth of implementing and utilizing technology or this ability of driving. But when you're actually, you know, this is the beauty of being able to utilize these programs over the, 25 years of saying, we're cash pay, we're going to do what's best for you as a patient. You're in the driver's seat. We're doing this to be able to actually drive this. And now we take that innovation and that innovation, and now we're plugging it into these plans and the ability of this innovation and working with Sonar Health to be able to drive this innovation. That becomes, for us, it allows us to have grown into the work that we've done independently to be able to make sure that we're not just another cog in a wheel to a system that Americans can genuinely feel like is broken, or it's like my cell phone is able to advance and I know AI's capabilities, but I feel like, why is it my doctor is still living in the dark ages? Again, no offense to doctors out there, because again, it's a system issue. They want to do the right thing, but it's not giving the system that allows it. So this is where for us it was saying we've got to keep pushing and moving this forward to make sure that we're developing systems that are working with people. But that's, that's where we're at.
Well, it kind of blows my mind because I think all of us have had loved ones affected by cancer, and see kind of how quickly that can spiral, especially when I've seen the chemo just start to really invade the whole body. Because you talked about if it's not killing the cancer because it's not the right treatment for it, or it's not going to respond, it's got to be killing something, right? And I hear you talk about this and kind of want to come out of my skin, because I'm like, I know people that have been impacted. And I think about when we started SHARx, and the brokers, the consultants, the clients that were coming to us saying, we can't keep doing this madness, these high cost drugs. We got a solution. And Paul and I would say we feel like we got the guy on the street corner handing out $100 bills, and everybody looked at us like we had three eyes, right? That's how I liken you a little bit right now. I'm sure you're well beyond that, but I wonder if you feel like that at times. And
I do. Corey, I do. I saw that it was a YouTube clip of a couple of, was that about a year ago? I was handing out again gold bars, and it's like people weren't going to take them. It was like, oh, there's literally it's hold on, what's the catch? And you're like, no, there's actually no catch. Take it. Oh, there's got to be something to this, and it almost it feels like that sometimes. But again, I do feel like that because it's like, no, this is it. It is. I love getting out there because it's like this just makes sense. It makes sense. And then obviously the data and the actual what we're doing, we've been around for 25 years and continuing to be able to grow. And this is where it's not just, we didn't just have a good idea and then start this up. And it's like, this is not just luck. This is hard work and innovation and growth. And we've got amazing teams, and we've got amazing, I invite anybody who wants, any broker want to come out and tour. We're always doing tours at Envita. Love to be able to share with you what we're doing, meet the patients, see the actual work we're doing. But again, I know that I could easily just go and take it easy and say, I'm not even gonna, not gonna get up and let's talk with the SHARx guys about, what we're doing here on the podcast. Easily just to be able to say, we're doing well, things are going well. But there is this drive of, there's a mission involved where people are suffering. And people are dying too young. I have an example of a case. This happens on a regular basis, but it was a great case example of this. It was about 4 years ago now, of a stage 4 lung cancer patient. The lung cancer was just littered through his body. 70 years old, and literally goes to the actual oncologist. And the oncologist says, you're too far advanced. You're older. So the therapy that I'm going to be given, don't even worry about it, because it's going to be too hard on you. You've got so much cancer. Just go and spend the rest of your life, which is a couple months, in hospice, because the treatment isn't worth all the negative effects that you are going to get. And I think for a certain extent, that's true. He's totally, again, I think that's an admirable thing that oncologist is, because he doesn't know that there's a different, understanding that's there. So it's like, again, I can understand that. But then the patient was like, there's something I want to keep treating. I don't want to not fight. So he contacted his friend, and the friend said, listen, I had a great response over at Envita. You need to be able to come out and just give him a try. Just see what the data reveals. And actually 50% of our patients are actually, as it is right now, are actually referrals from other patients. And I just love that statistic, because it's like, I'm not just getting a referral from a primary care doctor, another oncologist. I love the fact that I'm getting it from actual patients with actual referrals. And so when we did this, again, the patient came on out, evaluated. We found some amazing targets for him. Guys, within 2 months, only 2 months, he was completely cancer-free. Now, when you look at the data, wow, if he was to go through all the treatment regimen that was being recommended of him, that had only a couple of months success rates, and that it wouldn't even have been, all the side effects and all the issues with it, and then unlikely that he would actually respond, and it would, end in death in a short period of time. It was close to $1 million for that treatment protocol. Let me just tell you, our treatment protocol in 2 months was $130,000. 84% response reduction in cost. I just love this story, because it's this dynamic of, and then the cost is one thing, and this is what we're doing for employers and people, and being able to have plans that are able to allow this as an option. But what makes me so happy is that he spends his life with his family. He's able to get to Christmas, and he's able to spend New Year's. And guess what, guys? He's still alive today and he's doing great, and this is where, so he's gotten 4 years of his life back. And so I just love it because these are stories where without the data, I always say this, and I speak this so frequently, we're making decisions that are really life altering decisions based upon an insufficient amount of data anymore. And for us, it's one of these areas where it's like, let's get back into making good decisions based upon data. In every other industry, I feel like, in business, you're making decisions based upon the data. In every other industry, in tech, you're making decisions based upon data. We're always making decisions in data in every other industry. And somehow there's more data available in medicine than what's currently being offered by most institutions, primarily because of the actual insurance reimbursement dynamics with it. And so this is where for us, it's a matter of there's more data that can be made making better decisions for your own health and your family's health. We're talking a lot about cancer, but even like an autoimmune condition, some of the drugs that you're helping with are like MS drugs, very expensive drugs. You talk to patients that are on these drugs, it's like, they're nasty drugs. Patients don't like them. There's a lot of injections and, there's a lot of issues with them and they're very costly. We've had this example of literally, again, some of these MS patients, again, nobody actually, so MS is called multiple sclerosis, by the way. Let me go back. What it is that it's a condition, it's an autoimmune condition where the body is attacking the myelin sheath on the nerves. Okay, so this is where it ends in it creates a lot of pain because the nerves are becoming exposed. And so you have a lot of difficulty and pain on the nerves because they're being exposed by the autoimmune system attacking the sheathing around it. Doctors know this. Doctors know the pathophysiology. They know what's going on. You go to see the best rheumatologist or neurologist, they're able to explain to you exactly what's going on and the why, or they explain what is going on. They don't explain and don't know, or they don't run the tests for why. And this is, for me, it's asking the right question. I always like to say, why is this going on? And when you look at the published data, you actually find that there's actually great data on correlative dynamics of why this is actually, what infections, what toxin, and it changes for each person. So it's not one size fits all. It's not one disease. One infection is not always causing rheumatoid or multiple sclerosis, but you have usually a couple and a complex, and you start to see correlations, and then you run the data, and we're able to see these actual infections. This patient had 3 infections and a couple of toxins that we believed, again, they were in the 95th percentile, but we believed that were causing the actual multiple sclerosis. So we began treatment, and this patient had been dealing with multiple sclerosis for years and was going into disability. They were in a wheelchair. This was the one last stop shop before being able to go on long-term disability and essentially giving up the towel, right? And just saying, I'm done. We ended up treating this patient, and within 2 weeks, they got on one of the machines that we have where we treated the infection, we started to be able to clear, but we got her on this machine to be able to start to filter out the blood, where it actually filters out 100% of your blood plasma with things that are actually toxic to the system to be able to start to cleanse the body. When we did this, this patient, the very next day, it was the most magical and beautiful thing, literally is hiking up Camelback Mountain, which is in the center part of Phoenix, hiked up Camelback Mountain.
That's amazing.
And was literally had their life back. And so this is where, again, it's the data driven. You want to be able to say, is that the same protocol for every MS patient? Well, no. But you know what we do is that you want to evaluate, is there something there that we know in science that can be treated? Are we running the right tests to be able to evaluate? And when we find it, then you treat it, and then you allow the body to be able to do what it's been designed to do, and that's to heal. Our bodies want to heal. We have an immune system that wants to work. Why is it not working the way that it needs to? What are those obstacles I talk about? Again, this is the philosophy. It's not that I've got to manhandle the body to get it to do what it needs to do. Well, no, we need to be able to remove what those root causes that are evidence-based, that are in the data, that we've built these data sets over to be able to evaluate. And then we build the body up with those nutrients and the systems that are supportive of the body to be able to heal. And then guess what? I allow the body to be able to do the work. And so this is why, again, it's that dynamic. And again, that kind of I don't want to oversimplify it, but that's the beauty in it, that the body is so complex and so beautiful that many times I don't need to know all the microbe signaling pathways, but I do know when you start to support it, the body starts to be able to actually heal. And so that's, again, in a sense, I live in a time where I see miracles. I still consider these miracles, it's like there's a lot of work that goes in, but man, it is a celebratory moment when people get their lives back and you see this actual responses. I'm still overjoyed by it. Again, every time it happens, and we keep seeing it, but I still get overjoyed by it because it's real impact, real ability. And I'm just always so amazed at the brilliance of the human body and how it's been created, and that ability of when you actually remove those root causes and start to be able to support the body with what it needs to be able to heal. Man, watch out. It's amazing to see what the body is able and capable of. So
that just feels like the aha moment when you go, what's going on isn't right, and my body is capable of healing if I give it the opportunity to heal. And well, I know we're gonna run out of time pretty soon, but I wanted to ask you about Lyme disease a little bit because I know it is an area of focus, and I've seen friends, family negatively impacted. Can you talk about your findings and what what are some of the things you guys do in that area?
yeah, Corey, just you Sharon. I got one thing to say though, because again, it's so good just thinking about this. It changes paradigms. This model changes paradigms because it illuminates this. There's a paradigm. Again, I'll go back to my type 1 diabetes. When you think that type 1 diabetes is completely gone, or those beta cells don't produce it anymore. There was a Harvard researcher, this was about 10 years ago now, that was showing that if you give the body, the thought was the body attacks the beta cells are gone. So it's no longer producing insulin. And yet there's a Harvard researcher that was actually discovering, well, there's some things that are going on where if you give the body these certain dynamics, the body, and start to treat the immune system, the body actually creates new beta cell function. And yet it actually regrows, even with diabetics, type 1 diabetics that have been type 1 diabetic for 20, 30 years with zero insulin production, no evidence of beta cells. And this wasn't even stem cells, or this wasn't a stem cell transplant. This was just other medicines that were given to support the immune system. And the body starts to be able to actually produce beta cell function again. And this is paradigm shifting. Even to me, that I've been doing a lot of things with a lot of cool things with the healing of the body. But even that, when I came across this data about 10 years ago, I was blown away. And it just gives this ability to say, what else is the body capable of? The body, if we give it the healing things that are able to actually heal and set it up, what else is the body capable of? So there's that. Lyme disease. Okay, let me talk about Lyme, because Lyme, you're right, is this we just came out of a global pandemic, but I've seen Lyme being underdiagnosed, and again, it is endemic and throughout our country as far as this goes. And so you start to see Lyme, it can continue to be chronic. So many times people think about Lyme being that you get a tick bite, you get a bullseye rash, and then it only stays there for a little bit of time. Lyme grows chronic and can continue to remain in the actual system. And we see this even with testing like next generational DNA sequencing, where it's not just looking at your immune system's response to Lyme, and Lyme can evade immune system and it can suppress the immune system. So if all you're relying upon is an immune system test where the infection, similar, you can think about it like an HIV. HIV, it suppresses the immune system. And so if Lyme, which evades and suppresses immunity, if that your only way to be able to diagnose it is through an immune system test, then you oftentimes find false negatives, meaning you have it, but the test is showing negative. When we actually run it, we like, again, testing that's going to be more of a direct analysis. This is next generational DNA sequencing, where I can actually take the blood or the actual urine and run the test to be able to actually see, do you have the DNA of the bacteria? And so you can actually evaluate it to be able to see, yep, I have the DNA of it. So it's no question. There's no question. I mean, everybody that's like Lyme that doesn't exist, it's not, we can actually see directly that it actually does exist, or look at it under a microscope and stain it and see the bug that's there. So that's the brilliance. There's an issue in our country right now with diagnosis of Lyme. And so we've really, again, solved this issue with the diagnosis of Lyme. So we actually If you're questioning, do you have it? We see it. But it is a great masquerader of diseases. And this is where we've seen it, it can create joint pains and joint issues. So again, many times people think that it may be a rheumatoid arthritis, where it's not. It's actually Lyme disease. It can create muscle aches and achiness. It can masquerade oftentimes as fibromyalgia because nobody's able to actually diagnose it. It can affect, if it's in the actual electrical rhythms of the heart, it can create arrhythmias. And yet we've never actually diagnosed this. And people are getting a pacemaker. I've treated people with Lyme who have been on a pacemaker because their rhythms do not beat anymore. So they needed a pacemaker to be able to pace their heart. And after treatment, the heart was beating faster than the pacemaker. So the pacemaker wasn't even working anymore because the heart actually regained its ability to be able to actually beat on a proper speed. Okay, so that's beautiful. It also can get into the central nervous system, causing neuroborreliosis. And this is where it can masquerade with a lot of these actual diseases I've seen it with MS that have been misdiagnosed as MS. I've seen it with a misdiagnosis of various dementia, strange dementia cases, or brain fog conditions that the brain just is not functioning effectively. And so you start to be able to see these correlations with it as well. It can cause a real harm in that ability of that brain. We can even see this with some of these anxiety and various mental health issues as well. Oftentimes it has other symptomology that are accompanying it. It's not just anxiety or not just depression, but again, it can oftentimes accompany as well. So all of these things, again, it's a great masquerader. It's not just, again, in tick-borne areas of the East Coast, Pennsylvania, even though it's very prevalent there. My wife grew up in Pennsylvania, and she had, again, down her street, there was like 5 houses on a street that had people that were suffering, excuse me, with Lyme, and it's severe. I mean, it's debilitating. These poor kids that have Lyme that are being taken out of school, and their lives are being completely affected, and yet they're bouncing around from specialist to specialist without actually being a true diagnosis and evaluating it. So that's one of those areas where you need to be able to actually find and if you're having these complex symptomology and you're thinking, well, my gosh, I keep getting bounced around and nobody can really figure it out. Well, you need to, Lyme is always something important to consider. Obviously, we want to make sure we get the right diagnosis and then be able to actually make sure that we're treating it effectively. But it is one area that is, unfortunately, people are suffering when they're unneededly because of misdiagnosis and faulty treatment.
Mm-hmm.
Wow, I think hope that's a story that some people resonate with and ask different questions. And that actually kind of brings me to, I know one of the services that you offer to the Sonar Health members is a second opinion. And so I'd love to hear more about how that works and what are some common things that you find in looking at doing those second opinions for members.
Yeah, so I mean, one of the things that, well, again, a second opinion, I always like to say it's not just going, this is important, especially with people who have heard second opinions before, because this is something in the industry, that it's like, well, we do a second opinion, but this is a true second opinion. It's one of these areas that I think if you are just doing a second opinion, that is a standard of care. This is what the insurance company is going to cover. This is what I'm going to do. And other doctors are thinking it's almost a group thing, right? Mentality of let me do a second opinion and have the same opinion that the other doctor had. Then that's not helpful, right? Or many times you hear about it from even a cancer side of like, again, there's many times people are being misdiagnosed with cancer, which is just terrifying. Again, seeing this they're being misdiagnosed with the wrong type of cancer in a certain percentage of time. So again, the second opinion that other people are kind of advocating for out there in the industry is let me actually get the right diagnosis. Well, if your treatment plan, like the stage 4 colorectal cancer, depends upon the diagnosis being right, then yes, you want to make sure that you get the right tissue diagnosis because treatment completely depends on that. However, yes, we want to make sure that the diagnosis of the tissue is correct as well, but we also want to make sure that it is molecularly targeted to actually say, are there things that we're missing in this diagnosis? Are there chemotherapies that are correct? Are your root causes being evaluated? I mean, this is where many times they aren't. And then going through, this is these other areas that need to be evaluated and tested for to make sure that your outcome is the best. And so this is where you start to see these second opinions that I always like to say, it truly is a different second opinion. It's an Envita second opinion we've talked about a lot, but it gives you that second opinion of saying, of what we've talked about today. Is this actually different? What are my other options that are there? If I do have these complex diseases, or I've been to a rheumatologist or 5 rheumatologists, and everybody's trying to figure out what's the best, what is my diagnosis I have, or you have a small level of inflammation. You may not be diagnosed with an autoimmune disease yet, but you have some issues in the blood work that look like it's turning into an autoimmune disease. Have you ever heard this, right? People are like, oh, it may be turning into an autoimmune disease, but let's just watch and wait. I'm like, hold on. Now's the exact time that you need to be able to actually start to investigate, because guess what? Don't allow it to keep turning into an actual autoimmune disease that's actually targeting the body. It's starting to turn. Let's run the analysis on the gut. Let's start to heal the actual body. And guess what? A whole lot easier to be able to treat it before it begins. Right. So again, this is that dynamic. So yeah, when you get a second opinion, you do get this true, again, a large part of it is that biolytics process of saying, yeah, let's run the data. Let's run the data and let's start to be able to take this. But it's identifying those conditions that are saying, let's run that biolytics data, give you an actual second opinion to be able to see that's truly an actual second opinion with different thinking, data driven, and giving those recommendations to be able to see how can I actually stop this process when I can't find a rheumatologist in my area that's going to think like you. Well, I've been doing this a long time, and the real unfortunate thing is that Envita is a bit of this unique, a pioneer into the industry of, I believe that in 10 years, I really do think we've seen this kind of trajectory, that the things we were doing 10 years ago are things that are entering into the actual space now. I do think, though, that it's one of these areas that we're about 10 years ahead. And so when people are sick now, they need this level of thinking and this dynamic. Maybe with the advent of increasing technology and the speed of growth of technology, we'll see maybe it won't take 10 years, maybe it'll be 5 years. But it's one of these areas that when you need help now, Envita's kind of on the forefront of making sure that we're able to do this. And we're happy. I mean, this is where I love serving people. I love actually giving people the answers that they're looking for. If a patient is watching, I'm always saying to my example for my patient, the patients, anytime I'm giving this, is be an advocate for yourself. Ask questions. If your doctors aren't willing to answer questions, guess what? Find a different doctor. I got to be honest, because I love questions. I love the ability to be able to investigate, research, answers, and it's important that we're able to actually get those answers. Because if you're a patient, don't just say that there's nothing out there, because there is hope. There's answers, and finding the right doctors and the right treatment team to be able to actually get the answers that you're looking for, or get answers to the questions that you're asking. You want to be able to have partners and team members and doctors that are able to be willing to actually work with you and get those answers that you're seeking. So
all of it is so incredibly powerful. It's a paradigm shift. I think it's a bit like SHARx was a paradigm shift. And Paul, what we've put together with SHARx Plus and everything, how does SHARx Plus bring Envita into the equation as we kind of get close to wrapping up this? Because I think it's important to tie it together here.
Yeah, so I think what we're super excited about with our SHARx Plus program is being able to, as we identify a lot of our members have autoimmune conditions that we're working with, and saying, how can we, instead of procuring medications that treat those symptoms, how can we engage Envita and their specialist team to actually work towards root cause and get those members into a better state of health, instead of just managing a condition and changing medications and different biologics. And so that is something that we are very excited about, being able to partnering with Envita and their team to work for a lot of those members are now having access to work in a way that they've never thought was possible. Never even thought to ask the question of, well, why am I sick?
Yeah, I really appreciate the time, Doc, because your heart for what you do and for the patients and the people you serve and want to serve really comes through as you share. And I think we could talk for hours, I think. And your patients need you probably so at this point. And I think for us and Paul and I and our team, it's that same kind of thread through all this. And I think that's why we're so connected in this race, because we have a passion for what we do and want to say, okay, yeah, let's be excellent at procurement and supply chain management. And what if we can take this to the next level? And our partnership with you all allows us to start to help our partners go from just getting not ridiculously overpaying for these medications that their employees and their members need to, wait a second, what if I think about this differently? So, and I don't have to be in this situation long term, or cancer isn't a death sentence, or. And so I don't know if you have anything else you'd like to close with, but love to hear some final thoughts from you.
Yeah, final thoughts are there's just so much opportunity to be able to get access to patients all across America, to be able to actually have access to technology that and real results and real answers. So guys, I appreciate the time, and I appreciate what you guys are doing and being able to help serve companies and patients. And so it's been a great joy to be able to work together and be able to make sure that we're able to keep this journey going. And it's you can't unsee it. And so that's the beauty, is that once you see it, you can't unsee it. It's what keeps me up at night. It's what keeps me it keeps me more motivated than ever to be able to make sure that we're still, helping people across the country to be able to have real answers, real solutions to the difficult problems, the increasing cost of medicine, and the ability to be able to actually not just put an expensive band-aid over the issue, but really seek and have great results. When you do that, even it's not even just that they're getting better today, they're actually preventing these diseases. A lot of those autoimmune diseases, those medications they cause cancer because they suppress immunity, or they cause osteoporosis, and then you're dealing with bone fractures, or they're causing additional diseases in the future. And so you want to make sure that even with this is that, yeah, you're getting results today, but you're preventing and lowering costs, and you're improving outcomes for the future as well. So guys, it's a pleasure, and really grateful for the time today.
Well, thank you for what you guys are doing, and with your permission, I'd love to do this again, because I know I have a list of things I was like, man, I wish we could talk about this and this, and I know our time does get limited today. Paul, any last thoughts from you?
No, I'm so grateful for being able to speak with you today, and getting to know you over the last several months, and now having. And it's one of those things. I'm with the red pill too. I see someone, they have MS. You should call them. Like I can't help it but evangelize for what I've seen with my own eyes is happening.
Yeah, I appreciate it, guys. All right, have a wonderful day. Thank you.
Yeah, you too.
Thank
Can't
you.
wait to share this with our team. Thanks.